Hi, Dr. Sarah. How
Hello.
are you?
Doing good.
All right, so let's dive right into the questions.
Okay.
So, why is fixing pelvic drop so crucial, and what does it mean for your overall well-being?
Yeah, so again, pelvic drop, we're talking about having weakness in your lateral hip muscles or your glutes. And when that happens, you can get this dipping on one side when you're doing something like squatting, stepping, single leg activities like running. So why it's so important is that, again, when one pelvis drops, now you have uneven forces loading through everything. So through the spine, more impact on one side. Through the knee, we tend to get more of a kind of an inner angle. So stress is the inner knee. And then again, if you're kind of collapsing at the hip, then a lot of times people are collapsing at their feet too. So a lot of times, whether it's a runner or somebody who likes to work out and lift, I see that kind of a problem in back pain, knee pain, and ankle pain, and a lot of times pelvic drop is a big part of it.
Got it. So for those viewers who might be unfamiliar, and can you briefly explain what pelvic drop is exactly? I know you mentioned a little bit about it and how it manifests on our movement specifically.
Right. So again, it might be a little easier even just to kind of show as I explain.
Sure.
So again, pelvic drop, if this is my pelvis, right, this is the top of my pelvis, this is my hip. Again, we know what my knee and ankle are. Mm-hmm. So as I do something like a single leg squat, right, if my pelvis is dropping on the left side, so here I'm dropping and I'm getting this uneven kind of shift. So again, I'm loading more through my spine on this side, and on my knee and foot, I might be loading more in the inside because my pelvis is dropping on the left side, okay? And again, when we talk about that, like I said, usually a big culprit is the outer hip on the side that's holding the weight. So sometimes it's going up the stairs, right? So you're pushing with just one leg, going down the stairs, running, or single leg activities like, again, in a lunge, right? If you're getting this pelvic drop, you might be getting uneven forces.
And now, for someone who might be experiencing pelvic drop, how can physical therapy help, and what kind of exercises would you potentially recommend most likely?
Yeah, so again, step one is identifying why are you getting it, right? Is it something, a lot of times it's either a mobility issue or a strength issue. So maybe there's tightness in one side of the pelvis or the low back, or tightness in the muscles where you can't move without getting your hip and pelvis to do the same thing at the same time, right? So we might need to create some mobility and separation between the pelvis and the hip. Or if it's a strength thing, like I said, most of the time it's weakness in that outer hip. So we're gonna start with isolated activities to address the glutes. Might start if you're having a lot of pain where we're in open chain, right? So instead of standing and loading, we're maybe doing things on the table where it's opening, lifting in a very unweighted, unloaded position that's more comfortable. And then as that gets better, we progress back into more of those functional activities. So doing some activities on the step, doing some activities in kind of a running position to train that muscle and to be able to carry it over into the functional task that you want to do.
I know you mentioned a little bit too. Are there any specific activities or like habits in your like daily routine that can contribute to pelvic drop? And how can people be like mindful about
So again, more so than I think contributing factors, activities you do that make it worse, it's more about things we don't do. So a lot of times, again, our movements are front to back movements, right? We walk, we run, we squat. Everything, for the most part, uses our muscles in the front of the body and some of those back muscles. But we don't spend a whole lot of time doing side-to-side movements or rotation through our hip. So especially if you're doing a lot of activity, either on the trail, on the road, in the gym, and you're trying to lift heavy weights, you also have to make sure that you're working those supplementary muscles, those accessory muscles that are going to help support to make sure that as you load more here, you're not weak and caving in here or dropping again as you're doing things like power moves, box jumps, step ups.
Got it. And now, lastly, if there's one takeaway you'd want viewers to remember about fixing pelvic drop, what would it be?
Again, just that our bodies are built to move in all directions. So our workouts should include things that move in all directions, right? And it doesn't have to be heavy loading in each direction. But again, your warm-ups should address the outer hip. Your strengthening should address the outer hip. And then some stretching at the end to make sure that if there is more loading on one side, that you can kind of relieve that pressure in between.
Perfect. All right. Thank you so much, Dr. Sarah. And here you have it, folks. Don't forget to hit subscribe and like this video, share it with your friends, and until next time. Thank you so much.
Thanks.